Welcome, everyone, to this edition of AJOT Authors and Issues. Here on the AJOT Authors and Issues series, we like to talk to researchers about their research and other things to help bridge the gap between research and practice. My name is Stacy Reynolds. I am the editor-in-chief of AJOT, and co-hosting with me today is Brianna Elson, who is the AJOT student representative and also a PhD student at Virginia Commonwealth University. And our guests today are Dr. Tara Glennon, who's from Quinnipiac University and the Center for Pediatric Therapy, and Dr. Kelly Tanner, Jessalyn Dickerson, or Jess Dickerson, and Sara O'Rourke from Nationwide Children's Hospital. So welcome to all of you. They are the authors of a research article that was just published in AJOT, which is entitled Improving Practitioner Knowledge and Confidence in Early Intervention Coaching for Sensory-Based Concerns, a pilot study. So glad to have you guys here today. And let's just have us start by each of you introducing yourself and just telling us where you're zooming in from. And Tara, I'll have you go ahead and get started.
Sure. Hi, I'm Tara Glennon, and I am zooming in from Connecticut. I'm a faculty member at Quinnipiac University here in Connecticut, and I'm the owner of three outpatient therapy clinics specializing in sensory integration and encompassing all facets of pediatric practice.
Thank you. And Kelly, we'll go across the row this way.
Hi, I'm Kelly Tanner. I am the research scientist at Nationwide Children's Hospital, and I'm zooming in from Columbus, Ohio, from our main campus in downtown Columbus.
Woohoo. And Jess.
Hey everyone, I'm Jessalyn Dickerson. I'm a pediatric occupational therapist at Nationwide Children's Hospital, so I'm also zooming in from Columbus, Ohio at our main hospital. In addition to being an outpatient pediatric OT, I'm also serve as one of our evidence-based practice coordinators. So in that role, part of my work is supporting clinicians in translating research into everyday practice in ways that are meaningful and feasible and easy to implement in their day-to-day workflows.
It's amazing. And Sara.
My name's Sara O'Rourke. I round out our Columbus, Ohio team. I am an occupational therapist and also our occupational therapy program manager, where I oversee the provision of inpatient and outpatient occupational therapy services across our main campus and all of our close to homes.
Yeah, and I am really excited because your team at Nationwide has really been the leader in so many ways in terms of best practices for pediatric care and quality improvement. And I think this article is just more evidence of the good work that you all are doing. So we'll jump into it. I would love it if you could tell us a bit more about the project and how it came about. So we're talking about a couple of different concepts. We're talking about coaching. We're also talking about sensory. What was the issue or the gap that you guys were really trying to address at Nationwide?
We always have a wide repertoire of assessments that we use, and we knew we were going to start proceeding with and using and implementing the SPM2. And whenever we adopt something new, we always try to add education around it. And we knew we were going to have to provide some information to our staff on this tool and how to interpret the results.
And in the meantime, I had met Tara at a conference. I knew she was an expert in the area from her many publications and great work that she does in this area, and was interested in talking to her about our SPM2 implementation. I had also been working with Jessalyn as our EBP leader, and she was involved kind of on the implementation side in terms of building everything we needed in our Epic workflows and things like that. And then over the years, Sara and I had just always wanted to do something around sensory integration and processing, but really wanted to be able to do it justice and work with an expert in the area. So I think it was just kind of the perfect storm of all these pieces coming together, and Tara being so gracious and willing to collaborate with us.
Yeah, I think that's one of the key takeaways, Stacy and Brianna, that Kelly just said. Are you interested in doing this at Nationwide? Because I was talking about a project that I wanted to get off the ground. And so one of the key takeaways is don't be afraid to just speak up. Like this never would have happened if Kelly had not said, hey, are you interested in doing that project at Nationwide? And we were like, okay. And then off to the races we went. So I'm thankful she spoke up.
Yeah, really fortuitous. So I guess then, Tara, to you, what was your impetus for developing what you call the SAIL program, Sensory Approaches to Infant and Toddler Learning? What barriers was this program kind of designed to overcome, or what was, how was it going to improve on what initiatives they already had going in Nationwide?
Right. So when we published the first sensory processing measure, it was only for elementary and preschool age. So in the second edition of the SPM, it expanded the age ranges. And so it included infants and toddlers, 4 months to 30 months. And a co-author and I of the assessment always knew that we wanted to do sort of a resource, suggestions and strategies. And so that you could get the SPM2 assessment results, and then you would have a database of information to help you know where should I go from here. The problem was we didn't factor in that people were going to use it as a cookbook. And so what quickly became apparent is that there needed to be a fuller package of information. So some of the background of sensory integration theory and intervention, something that led to the practitioner's own clinical reasoning, that they could take the information from this database of suggestions and strategies, but really then factor in their own knowledge and expertise from the background information. So we really started with the Spark, which was the professional reasoning kit with the database. And then I then took it from there and said, okay, we need a bigger, fuller program around this. So that's where it started.
And I guess just one more follow-up to this is that, maybe this is for the Nationwide folks, is that, you did make a decision to focus on the sensory pieces, but you had also seen this other issue related to coaching and how your clinicians were coaching families. So can you just talk to that a little bit more about how the coaching and the sensory kind of came together for this project?
So we had a previous project that was funded by the American Occupational Therapy Foundation and is also published in AJOT, where we focused on implementing caregiver coaching for young children with or at high risk of cerebral palsy, and used sort of similar educational methods, but was definitely a different type of project. But what we found was that a lot of practitioners were kind of taking that information and extending it to other populations that they were working with. So we wanted to kind of build on that knowledge base that we had built around caregiver coaching in an outpatient hospital environment, but kind of focus on a different population. And we know that for birth to 3, caregiver coaching is so key to building those enriched environments and teaching caregiver strategies that they can take into the home environment. So we wanted to figure out how to do that, but for specifically focusing on this population that Tara is an expert in and that we were focused on.
Yeah.
Right. And the whole, early intervention concept, while we did it in this hospital-based environment, they also have satellite offices, what they call close to home. And the concept of early intervention is around caregiver coaching. I mean, that's the basic philosophy of it. So it was a natural fit for the age range that I was interested in, that infant toddler range, and as well as the sensory. So that seemed to fit nicely.
Yeah. Sounds like a strategic alignment with things you had been working on and done, with new things being brought in a really strategic, organized sort of way. So
right.
Kudos to you all.
So the SAIL intervention or program was intentionally designed as a 7-month distributed learning module. Can you describe this a little bit more? How did you determine the pacing, the sequencing of the webinars, mentorship sessions, and the Spark access?
Right. I had 2 literature bases that I had to deal with. One was the sensory literature, and how do we create a situation where practitioners feel confident and knowledgeable about implementing sensory. And then I also had the early intervention literature, which talked about creating professional development that was meaningful, useful, affordable, accessible. And so the webinar piece of the SAIL and the online database piece of the SAIL, the Spark program, naturally fit with meaningful, useful, accessible, affordable. Then we also had to deal with the literature that said one-shot workshops are not enough, that you need some ongoing consultation. And in the sensory world, we talk about when you want to have practitioners who are proficient in sensory, you need mentorship and ongoing mentorship. So from there, the mentorship piece was important, and we arbitrarily decided, quite honestly, 6 months of mentorship every 2 weeks, because the literature also talked about spacing out professional development, which allows time to for the practitioner, the frontline practitioner, to assimilate and practice and reflect. So it was an arbitrary. We started the webinars. Before the webinars were over, we started the mentorship so that people could be asking questions about the content from the webinars. Then the mentorship continued, and the literature also supported allowing practitioners to look at videos. So we asked practitioners at Nationwide to bring videos, and we analyzed videos. And so really used it as a mentorship sort of consultation model. And then they had access to the Spark online database with the suggestions and strategies. And so the mentorship sort of spanned over the webinars, then mentorship of clinical experiences that they were dealing with day to day, and then extended into when they had access to the online database. Yeah.
And I'll echo what Tara just, she was not right on the mark with that, but from an EVP and implementation perspective, we know that simply distributing information isn't enough to meaningfully change practice. And we've seen in past projects where, when we roll out a webinar and knowledge in different formats, clinicians might gain that knowledge, but in order to apply it and reflect on it and receive feedback, without that, those changes are difficult to sustain over time. So that was front of mind when we were, considering the format of this program.
I love that you guys, we think about using theory to make treatment decisions, but you guys drew on learning theories and behavior theories and implementation science theories to develop this program. And so it really has that theoretical grounding and a strong base for how you implemented it. And I think that's a really cool application.
Yeah. We were juggling a lot of different literature bases.
Yeah.
Yeah. I think even just hearing Jessalyn talk about clinicians reflecting and receiving feedback really echoes a lot of the principles that we were teaching them to use with caregivers. So a lot of it is just like good principles of education and how do you make sure that people are really understanding what you're telling them and able to repeat it back and apply it.
Yeah.
Mm-hmm. Yeah. The application piece is the biggest piece, which is also the most difficult piece. So, but it's great. I love the, like Stacey mentioned, is just the use of the implementation science theory and being able to take just the webinar, but it's not just the webinar. Like there are other pieces that need to be integrated in order for it to really stick and be used in practice too.
Right.
So that's awesome. So all the OT practitioners in the Division of Clinical Therapies were invited to participate. What strategies did you use to encourage the participation of those therapists?
Yeah, thank you. We wanted to be really intentional about making sure that our clinicians were able to get the most out of this education this opportunity that Tara was offering to us. So that was something that we considered, was making this realistic and compatible with their everyday clinical workflows. So part of the pacing was also to give the therapist time to try out these strategies between mentorship sessions, and then bring back questions that they might have, or bring back other observations or questions that they might have come up with, so that they could revisit those concepts or questions during the mentorship sessions to really deepen their understanding. Some specifics: we kicked off the webinar series with we first located a group of sensory site champions. So from the individuals that demonstrated interest in the project, we found a group of that we designated as sensory site champions. So within our department, we have our main campus and then multiple different offsites. So having a sensory site champion at each of the offsites to serve kind of as a point person. That person initiated a watch party for the first webinar, where the group got together and watched the first webinar. So we hope that would kind of get the ball rolling for the individuals to watch the rest of the webinar series. And so that, combined with the different formats and the mentorship sessions, so the asynchronous webinars and then the asynchronous ability to use the Spark database, combined with the live mentorship sessions, which were also recorded for people to watch later. That, served as a kind of different formats where people with different schedules and working at different sites were still able to access that information.
Right. I will also add, Brianna, that offering CE units didn't hurt.
Yeah, definitely.
Everybody's looking for CE units that they can do from the comfort of their own bed. So,
Yeah, yeah, absolutely. I mean, well, it was whatever you used, it was helpful. You had the 50 practitioners complete the baseline survey and 19 complete all three surveys, which is pretty good. What were some of the issues or barriers to completing the full mentorship program that you may have encountered?
Yeah, I can kind of take a stab at answering that one. I think we are real people in a real workplace and really busy. And I think being in a real clinical setting, there are inherent barriers with our staffing models. Not everyone works every day. We staggered times to capture as many as we could, knowing we wouldn't be able to get to everyone. And sometimes these sessions would conflict with specialty clinic service delivery that we couldn't really wiggle around or reschedule. But they were all recorded for staff to rewatch if they had time off or if they were in a space where they couldn't attend. But we also asked for live interaction. And that is a really critical piece of mentorship in adult learning, is being able to really engage and ask your own clinical questions and take an active part of your learning. And with some of that caveat, that could have just lessened opportunities for participation a bit.
I wonder, sorry, it's making my brain go in other places in academia, is that I think we're seeing a shift in our students as well of wanting to be more passive and receiving information. And sometimes it's harder for them to take that active role that we expect in adult learners. So I wonder if there are other pieces there too with that model. And it's hard sometimes to engage if you haven't been in that pattern of kind of actively looking for that feedback. But that's really interesting. Okay, let's talk about research for a second, because we do like to talk about research design as part of this AJOT feature. So what you used was called a prospective cohort pilot design, and you had 3 data collection time points. So again, there were 3 kind of surveys, as Brianna just said. Why did you choose this design? Why do you think it fit the SAIL program, and why not do something like an RCT, for example?
okay, I'll take that one. So I think you have to go back to what is the core mission of the SAIL program. And so we were talking about a professional development program, which is different than providing an intervention and did the client make a change, right? Your effectiveness or your efficacy studies in an RCT. And so this brought us into sort of the implementation science world, which was sort of, I guess I was doing it for years, but not really understanding that there was a whole discipline around that. So I was always interested in what were the facilitators and barriers to therapists implementing what the literature said we should be doing. But when we went to sort of this implementation science approach, what we're talking about were what were the strategies, the implementations that you could do that would narrow the gap between knowledge and practice. So we have the information of what practitioners should be doing and what is stopping or a barrier to them actually doing it. And so the implementation science framework, that sort of research world fit this model of what we were trying to do.
Yeah, and I'll add another very highly related framework is quality improvement science. So Sarah and I are both formally trained in the model for improvement as endorsed by the Institute for Healthcare Improvement. So we thought that was a perfect fit for this project as well, since our goal is really to provide the best care we possibly can to our patients and families. So our objective is always just to get the people to do the thing. I say we just want to get the people to do the thing, using whatever strategies work the best. not necessarily testing out which strategies can best help the people do the thing. That might be more of a randomized implementation science design. For this part, we were really just focused on that implementation piece and showing that we provided this education and that there was some improvement there.
Yeah, I totally set you guys up with that question because, and you did perfect in answering it. But I do think there's still a lot of confusion in OT and probably across rehab disciplines of everything needs to be an RCT or everything needs to be this gold standard or everything needs to be effectiveness. And I think there's more awareness now of quality improvement research, that body of work and implementation science work. I think that's growing, but I think this is a really perfect example. Going back to what Tara said is like, what is the purpose? What are you trying to do? You want people to do the thing. This is a study about how do you get people to do the thing. So I think that that's really important for people to keep in mind of like, what is the intention? What are you trying to do? It doesn't always have to be efficacy or it doesn't always have to be effectiveness. So thanks.
Yeah.
Your key participant outcomes were knowledge of sensory integration, confidence in sensory integration, knowledge of caregiver coaching, and confidence in caregiver coaching related to SI concepts. I think I got all of that. Based on the design of the study and the SAIL program, why did these outcomes make the most sense?
Yeah. I guess I will back up in terms of the methodology
Yeah.
because one of my difficulties and that have prevented me from doing a lot of research is it always seems to get so big so fast. Oh, we could do this. Oh, we could do this. And so finding a way to make something meaningful yet manageable was a big issue, that it wouldn't get away from us. And as we were looking at really what was the core, the professional development, and we looked at, I hate to say it, always going back to the theory. And if you look at Bandura's work early on, right, if you're looking at self-efficacy, does a person do what they believe they want to do? It's important to have a positive outcome that you have the knowledge, the skills, the confidence in your own efforts. And so we tried to focus on knowledge, skills, confidence, which were the underpinnings to self-efficacy. And so that's what we tried to measure. And we tried to, there were so many things that we wanted to do, but we're like, nope, keep to the task. Don't let it get unruly, unmanageable, because then you end up with nothing because you have so much data that you're trying to juggle. So we were really trying to very specifically hone in on the knowledge of sensory, the confidence in sensory, the knowledge of caregiver coaching, which many early intervention therapists have, but do they really use it? And the confidence in caregiver coaching specific to sensory related issues. So we just stuck with those four and followed the thread.
And I'll like follow up on that and just say that Tara is such a skilled mentor that I think that confidence piece of, people who showed videos or even just watched Tara work with somebody who it's a pretty vulnerable thing to show yourself treating and kind of open yourself up for feedback. And Tara just did such a good job. I think everybody who did present a video and walk through it felt really good about their session in the end and certainly picked up some things that they could do differently or better. But I think a lot of it is just that cheerleading piece of like, you're doing a great job. Look how well you got that kiddo's attention. Look how well you picked the next activity. And I think that's the power of having that live kind of feedback and an actual case to talk about.
Right. It was fun. And Kelly was very astute in taking the notes so that we could document specifically what happened in the mentorship sessions. And then at the end of each mentorship session, we let the group decide what did they want to focus on for the next mentorship that might have sort of quickly sort of parlayed over into another concept that they had been thinking of, but maybe not have been prevalent at the moment. So the mentorship sessions, actually, I was afraid of them. Doing them asynchronously, synchronously, but virtual. And they ended up being much more impactful and fun than I had envisioned.
Yeah. Well, because you were coming into them cold too, Tara. you would just see the video and have
Yeah.
to
Well,
react.
and the
Yeah.
truth is we all have
Yeah.
imposter syndrome. I don't care who you are. You have imposter syndrome over something. So walking into them cold and not seeing a video of a child, but then analyzing with someone, it is. But I think that that contributes to the mentorship process because it allows me to say, all right, I'm not sure, but I'm going to problem solve out loud and let's walk through the steps of our thinking and our clinical reasoning and really demonstrating to them that it is a struggle for everybody and you just have to go step by step by step. And doing that in real time, I think was really helpful for all of us.
Yeah.
I think you being able to kind of show, like you mentioned, being able to show that you are also kind of learning on the fly too, just makes it feel a little less intimidating, more comfortable to kind of be vulnerable of like, I really don't know. I need your help with this. So that's awesome that you're able to build a rapport even virtually too.
Yeah. Yeah. And I think also being able to say, when you're watching a video and the session goes awry, right? It doesn't go as you plan. And just sitting there saying to them, "Oh, I hate when that happens."
Yeah.
That happens so often. And
Yeah.
letting them know that that is part of the process. It's not all
Mhm.
going to go according to plan. And you just say, where am I detouring here? And let me get back on the path. So, yeah.
It happens to all of us.
It does.
We also collected data on the acceptability, appropriateness, and feasibility of the SAIL webinar series and the SPM2 Spark Online database. What additional information did these measures give you?
Sure. Well, going back to the literature that says it needs to be accessible and affordable and pertinent and helpful, in implementation science research, there are 3 psychometrically sound tools that you can measure that. And so we implemented those 3 tools, and they really asked questions about was it applicable? Was it suitable? Was it easy to use? Was it a good match for what you needed? And so being able to use those 3 sound psychometrically tools, we were also then able to sort of again follow the thread of implementation science research and what they say should be part of your outcomes measurements. Yeah.
Um, yeah, I feel like we could talk so much more about the implementation side of things, but let's just talk a little bit more about the scores and the follow-up. So the stability of the scores from post-test to the follow-up, because you measured multiple times, suggests that this works, that people did the thing, right? That there was retention. What do you think contributed the most to that sustained improvement?
I think if you provide professional development that's meaningful and practical to the practitioner, and they can implement it and in an ongoing way get that consultation, mentorship, feedback piece, I just don't think learning goes away. Like if you've learned something that's meaningful and practical for your use and you're using it, I think you retain it. Now, I would argue that I would have hoped that it would have improved so that at the first
Yeah.
time point baseline to the second, they would have shown improvement. I would have loved for the improvement to even improve more on the follow-up because they were using it and embedding it in their daily lives. So that would have been fun. But the fact that they maintained it is sort of good enough for me at the moment.
Yeah.
Yeah.
What about in terms of feasibility? Did you guys identify any areas where you would, if you were to do this again, or if you were to implement this with a different group of folks, were there feasibility things that you would choose to do differently?
Yeah, I think, we are, again, a real place and our clinicians are very busy. And a lot of our communication kind of went through email, calendar invites. This is what's happening. This is what's coming. And I think for a clinician on a really busy day, sometimes those administrative things kind of fall by the wayside and we get to it when we get to it. And sometimes it's not always in real time. And so many staff would sometimes come and say, oh, shoot, I didn't realize this. I didn't get my patients rearranged in time. And many opted to use their leaders to help them find the time and be sure they blocked the time, because in the midst of seeing patients and doing their notes, sometimes those extra asks and extra tasks would get away from them. So we made several plans with leaders of, when you see these come across, just assume I want to go, and please go ahead and block my schedule and help me get these patients switched around so we can attend in a way that felt a little bit easier to them.
And I'll, I think, highlight there the importance of having Sara on the team as our program manager, having the operational support of Sara telling the clinical leaders who report to her, like, hey, people can reschedule patients to attend this. Please help them make this work. This is really important to us as an organization. I think that's so key for the success of our program and doing projects like this. It's amazing to have Sara. And I did take a look at the data this morning. I didn't see any specific feedback from people about areas for improvement. But working with Jess on a lot of our education and evidence-based practice, we have really taken this format forward to a lot of the education that we're doing. We're thinking a lot about how we can, instead of lecturing at people at a specific time, providing that information in a way that they can access it ahead of time, and then really using our precious live time together to answer questions, have discussions, and interact with each other. I think this project just really showed that, like, we could just talk and learn as much as we could, as if I just lectured at you with a PowerPoint deck. Anything you want to add about that, Jess?
So, I mean, I would say just I don't know if we want to get into the autistic practice guidelines mentorship series, but just that we've taken this kind of concept and have like a built-in reflection piece to every kind of tidbit of knowledge that we roll out from these bigger projects, just because, and that we know from like the implementation science literature how valuable reflection is. So I would just say that was a nice takeaway for us to relate to other projects. Yes.
Right. Yeah.
I will also add to, sorry, Stace.
No, I was just going to comment on how nice it is, like you said, to have the organizational support and the value that Nationwide brings to evidence-based practice and growth and quality improvement. And I think that that's important for people who might want to model something like this in their setting, is that they may need to get that institutional support or make sure that the OT manager is on board and the administration is on board to do things like rescheduling clients, that systems level support sounds like essential for something like this to work.
Right. I think we're on the same path there, Stacy. When you look at sort of the implementation science research world, it is not just the practitioner determinants, right? It's not just their own facilitators and barriers. There are organizational and structural and philosophical. And I think that's where some of the research projects have difficulty, because that institutional support that Sara was able to provide, honest to goodness, we'd be in the planning meeting. She'd be like, I'll take care of that. And I'm like, okay, great. And it was really key in bringing the project to fruition in the time frame that we wanted to, and not just sort of trailing off and never getting it done. So it was unbelievably key to getting the project completed. Yeah.
Great.
I love what you said too about not lecturing at people. We're trying to do the same in our rehab hospital where I work, where we do CEUs that are 2 days long. So we're trying to figure out different ways to break it up, because, like you said, the literature shows that people learn better in those other modes of delivery. So it's time a lot of us kind of move towards that direction if we're really trying to look at the application piece of the information into patient care and practice. So that's awesome. Many EI programs still default to child-focused intervention. How can SAIL help teams shift towards a coaching-centered model without overwhelming practitioners?
Yeah. Hey, Jess, I'll let you go first on this one.
I would say that this SAIL and the Spark, the database, that really helps coaching feel more manageable rather than overwhelming, because it wasn't asking clinicians to totally change how they're practicing. rather more just small intentional shifts in how to involve caregivers and siblings and other family members in routines, and how to reframe conversations that clinicians are already having with families, how to reframe them in a way to follow more of a coaching approach. So I would say just making it feel more manageable. And also personally, I had a lot of takeaways just from the language that Tara used in her knack for breaking down really complex like concepts in a way that is really easy to understand. And so I think that in itself was very valuable in terms of how to explain this information to caregivers.
Yeah. And I think also the concept of coaching, right? You're trying to share information and have this sort of dyad between two adults where they're problem solving together over issues. And we know from the literature that that has the most impact. And I want to be careful of my wording here. I don't say we're empowering caregivers. We are creating a situation where caregivers feel empowered, right? I don't give that to them. They generate it. But the concept of we're in this together, we're going to figure this out together, I think has a really powerful effect on caregivers and their own self-confidence in supporting the development of their own child. So I think that coaching model, if the slight shift happens, I think it naturally leads to feedback between the two adults, and which then sort of supports itself and sustains itself.
Well, another follow-up question to that is, what considerations should practitioners keep in mind when adapting sensory coaching strategies for families with limited time, resources, or environmental supports? Going off of what you said earlier about the organizational support being a huge facilitator, and not everyone, unfortunately, having that in their,
Right.
where they work.
Yeah. Okay. Two parts to this, Brianna. If a family doesn't have a lot of internal resources, I'm not going to fix that. But it is my job to help figure out a way how to strategize, how to navigate, how to foster the caregiver's sense of competence within the confines of their own structure. Um, it's interesting because some of the videos that the practitioners brought to the mentorship meeting, they were talking about doing a home visit in a trailer where literally the room is like 10 by 20. And how are they going to do these sensory things? And how can I adjust the feeding environment to make it more successful? So those are the realities, and I'm not going to change that. But how can I help navigate within the confines? And really, the concept of the coaching, where you're problem solving together, allows the caregiver to get that sense of competence. And coaching really is about, for me, from my perspective, is I'm not the expert. I can strategize with you, but I'm trying to promote your own problem solving abilities for when I'm not there. Because
Mhm.
I'm not putting your child to bed with you. I'm not giving the bath. And so finding a way through that coaching, we're in this together concept, I think creates a situation where caregivers begin to take hold and responsibility of what they can also make changes to the child's daily life. So I think it's helpful.
I'll add to that I think as a profession, as OT practitioners, we're already so well suited to treating each family and each individual or each person on an individual level and finding out what's meaningful to them and what barriers they might be navigating. And I think another big important part is building a strong rapport with families so that you can get to that collaborative stage, because having that rapport will make caregivers feel comfortable when you might make a suggestion during that collaborative planning process. If you make a suggestion and they might, be honest with you, say, I don't think that's going to work. And then you can go back to the drawing board and come up with another solution. So I do think that piece is really important. And then from there, we get to, this is an opportunity to lean into our creativity as OTs. If we have the knowledge and the confidence, we can then use our skills with flexibility and using materials that might already be in the home, so that we can, co-create strategies with these families.
Yeah.
Thank you. That's good information, I think, for a lot of people who just don't have the support. It's the reality of what they're working with, but knowing that you can still do a lot for them, even within the constraints of what their reality is.
Right.
So, as we wrap up, I'm curious to know, what advice would you give to organizations that want to build capacity around parent coaching or implement a program such as this?
This is, I think, where it gets a little bit difficult. And I'll just as background, right, in the political environment that we're in, where the federal government has sort of disbanded the Federal Department of Education that offers early intervention services Part C, right, for children under 3 years, and put it back to the states, that we're now, I think, more in a situation where there are 50 plus state organizations and philosophies and procedures and policies. So I think it's going to be a state by state situation. And so what I'm trying to do next is identify one state where we can do it. Now, the therapist within that state in the early intervention system will have to commit to the mentorship. That's the only thing that they have to commit to. But the webinars and the access to the online database can happen. But I think it's going to be each state. So we have identified a state that has a good infrastructure, because as we've found with Nationwide, the infrastructure is really key. And so trying it out in a few more states, refining it a little bit for a state system, I think are the next steps. And we just won't know until we go state by state to see what will be helpful in those states. But the core of it, the coaching parents to help foster their ability to promote the development of their own child, is still the core. And so that should still stay as the sort of forefront of what it is we want to be doing.
I think that was a great answer, Tara. Thinking about like generally implementing a program, I've been doing this work for a while. And when we first started, we would just push out a lot of education and just sort of assume that people were doing the thing. So my advice would be to actually collect data on your efforts. Another piece that we're working on is looking at what people documented in their notes during and after this program. So we are gathering that data and analyzing it and looking at, did people change their behavior in terms of how they documented things? So anytime you educate somebody at your organization, I would say just try to measure it and see, did the people learn, and did you impact them at all in a way that you could measure?
Great advice. Great advice on both accounts. Well, Tara and Kelly, you have been on the Authors and Issues series before, and Jessalyn and Sara, I think you are both new, but we like to end our really serious discussions with a fun party game so that we can get to know you guys on a whole nother level. And even by your introductions today, I could tell that you are all very busy people. You hold multiple job roles, and I'm assuming you do things outside of work as well. And I'm really worried that in 2025, you potentially missed things that were going on in our world. And so we're going to test today your knowledge of pop culture and current events with a game called Did You Even Notice the World While You Were Working?
Oh no.
This will be a multiple choice trivia game. I think I have 7 questions. And you guys can work as a team to answer these, okay?
Yeah.
All right, you ready to play?
Yep.
Ready.
Your first question is, who just won the college football playoff national championship? Was it A, the Miami Hurricanes, B, the Indiana Hoosiers, or the C, Ohio State Buckeyes?
I don't
this
know.
one, I'm sure.
Yeah, we know this one.
We know.
Yes, it's Indiana.
Indiana.
I had to make the Buckeyes say it out loud.
I know.
Way to rub it in, Stacy.
I
know. At least you were paying attention.
Yeah, at least.
All right. Number two, which type of phrase made it into the dictionaries in 2025 reflecting teen slang or expression? Was it A, Zoomerish, a millennial slang for Gen Z? Was it B, autofish, an auto-generated fish image trend online? Or is it C, 6'7", an expression tied to a meme?
Mm.
Gotta be
I'll say
6'7", right?
6'7".
Yeah.
All right, you guys got it. 6'7". At least one of you, I think, has a middle schooler, I don't know, or a preteen.
Ours are a little younger, but
Yeah,
it made it all the way down.
elementary.
I was gonna say, yeah, my third grader came home with it, so it did make its way down. All right, you guys are doing great. At the Golden Globe Awards, which were recently held, which movie won for Best Motion Picture, Musical, or Comedy? Was it A, Blue Moon, B, One Battle After Another, or C, Marty Supreme?
Oh, I think it was One Battle After Another. Is that what it was? Anybody else?
Nothing. I got nothing on this
I had
one.
no
No
idea.
idea.
We'll
I
take it.
heard-
That's correct. One battle
Good.
after another is correct.
Good job, Tara.
I didn't see it and I had never heard of it, but it was the Leo DiCaprio one. Yeah, I think that's the one.
Well,
Okay.
I was confused because I didn't think it was a musical or a comedy. It looks like an action movie, but it won in that category. So I thought I might trick you guys with that, but apparently not. All right. This is one too, might be for the ones with preteens, but which of these songs recently topped the Billboard charts and won Best Original Song at the Golden Globes? Was it A, Golden from K-pop Demon Hunters, B, Daisies by Justin Bieber, or C, Opalite from Taylor Swift?
It's
I
got to
think
be
it was
A.
Golden.
Yeah.
It's A. Does anybody want to sing it?
It's
I'm
actually one of
kidding,
my
no.
favorite songs.
It's so catchy. I find myself like humming it, and I'm like, I haven't even seen the
It's a good
movie.
one.
It's a catchy song. All right, you guys are rocking it. You've got them all right so far. All right, real quick, we'll do one more. No, we'll do two more. What word did Merriam-Webster's name for its word of the year in 2025? So this is a word that captures broad cultural trends. Is it A, slop, describing low quality AI generated content? Is it B, gaslight, manipulating somebody into doubting themselves? Or C, metaverse, which is a collection of virtual space where people interact using digital avatars?
I think it was slop. I feel like I might have read this article.
That is amazing, Kelly. Yes, slop. I had never
Okay.
even heard that word. It is
Yeah.
a word describing low quality AI generated stuff.
Yeah.
All right,
Okay.
let's see if you guys can get a perfect score here. Last one. Which country or countries will host the 2026 Men's FIFA World Cup? Is it A, Spain and Portugal, B, Qatar, or C, United States, Canada, and Mexico?
It's C.
It is C,
Canada,
United
Mexico.
States. You guys, come on.
Really?
Great. Power team.
Oh,
Yes, so
We're gonna do trivia together sometime.
I was going to say,
Yeah.
collectively, you guys have paid attention to the world. Well done. Well, thank you for playing my party game. I do feel like I know you guys all a little bit better now. Last thing before we wrap up, is there anything else you want to tell our listeners or any resources you would recommend to people who want to learn more or do more in the space of quality improvement, implementation science, or coaching, or SI?
yeah.
All the
I
things.
think one of the primary things that I will say is the synchrony between clinicians and researchers is key. Now, Nationwide happens to be both, and so their infrastructure is there. But I think one of the key things was that Kelly just sort of said, "Oh, are you interested in?" So don't be afraid if you have an idea to say something to someone who's actually doing it, because I think that may be how some of the best partnerships sort of emerge. Yeah.
And Kelly, I'm going to put you on the spot. I know you've recommended some resources before for
Yes.
people who are interested in things like learning health systems and
Uh-huh.
quality improvement. Do you
Yeah.
want to recommend a couple, maybe conferences or things that you've gone
Yeah.
to? You said you ingested a training or certification in
Yep.
quality improvement initiatives.
Yeah. So for quality improvement methodology, I recommend checking out IHI.org. That's the Institute for Healthcare Improvement's website. For implementation science, there's a really nice free self-paced module series under TIDIRC. I'm not going to get what that acronym is, but it's the TIDIRC self-paced implementation science modules. For learning health systems, I recommend checking out the LEARN program, LEARRN, through Pitt and Boston University. They have a really nice website with a ton of resources and recorded case studies of learning health systems and that sort of thing. I think those are my top hits.
And we can put some of those links in the section below the video.
Perfect. Love it.
Yeah. And Stacey, I'll also say if there is an organization or a state early intervention program that wants to run this program in their state, please just contact me. I am more than willing to do it. It's sort of like a mission of mine at the moment. And so just go to the article, find my contact information, and email me. I'd be happy to set it up and make it available. But we are also trying to make this wholesale program free, and it would be online. My only fear is that they need to be part of the mentorship, right?
Mhm.
So that there has to be a commitment to the mentorship piece. You can't just take it like a cookbook. So,
Yeah.
but if anybody's interested, just email me.
Fantastic. Well, thank you so much for being here today, for giving your time that I know is very precious. We appreciate your insights. We're excited about this work. And just a reminder that this article will be available open access as soon as we post this video, so that it can be shared and everybody can benefit from learning about what you all did. So thank you so much and good luck with your future work.
Thanks, Stacey.
you.
Thanks, Brianna.
Thank you.